there, my name is Dr. Kathryn Garforth from Garforth Education, and it is Disability Awareness Month and October Awareness Month. In the month of October, there are so many different awareness months, including Autism Awareness Month, ADHD Awareness Month, Dyslexia Awareness Month, Down Syndrome Awareness Month, Mental Health Awareness Month, and Dyslexia Awareness Month. And today I have Mandi Sharkey joining me, and we're going to be discussing the comorbidity of some of these conditions and how just because you have one doesn't mean you can't have more than one. So hello, Mandi, how are you?
Hi, I'm great. Thank you for inviting me.
Why don't you tell us a little bit about yourself, who you are, and how you got to be in your position?
Sorry, the cat's trying to change my screen for me. So I am a certified teacher. I have my master's degree, and I'm currently pursuing my educational doctorate. I am a behavior consultant. I have low arousal training. I have a little bit of everything. Natural play therapy training. So I've just been helping families doing systems navigation, so like understanding how the system works, and systems translation for the past 6 or 7 years. And now I'm back in the classroom. I happen to be teaching kindergarten this year in a twice exceptional school. So.
Very exciting. So what are your views on comorbidity? I know there's a lot of confusion about what it actually means and how it's actually possible to have more than one of these conditions.
Okay, so so the language is hopefully changing around this. Comorbidity is the medical language. Co-occurrence is a little bit more people-friendly language, shall we say. So there is a possibility to have a co-occurrence of several things. You can have co-occurrence of attachment issues as well as ADHD. You can have, my husband has ADHD, dyslexia, a PTSD, right? Like they can all still happen at one time. You will have some overlapping diagnostic criteria, characteristics might be a better word. You can have very much overlapping characteristics throughout a whole bunch of different disorders that are in the DSM. So hyperactivity is not only a characteristic of ADHD, for example. It can also be a characteristic of fetal alcohol, or it can be a characteristic of autism as well, because it could be part of that repetitive and restricted movements. So I think it's just getting people to recognize that, yes, it is possible. It takes someone who knows kids or adults who have seen enough cases of co-occurrence to actually be able to help you tease out what applies to what diagnosis. And then I guess it's a matter of getting our education system to understand that these all play a part in how we help kids.
Yes, for sure. And also understanding that just because you find one diagnosis doesn't mean you should stop looking for other ones.
Especially if it doesn't explain everything.
Exactly. And that's a huge thing that I know I see. Whereas, oh, okay, well, they have dyslexia, so we don't need to look further, or they have attention deficit disorder and they can't read because of that. It's not possibly because there's another co-occurring condition.
Exactly. And sometimes it's kind of silly because we attribute a lot of things to autism, say, that just aren't explained by autism, right? Or the same with ADHD. We, like you said, the reading or even the math. Well, they can't because they can't attend. Well, it may not be that they can't attend because of the ADHD, right? Must be something else going on there. And then people don't often understand that sometimes dyslexia is going to co-occur with dysgraphia, right? The inability to get your thought onto the paper, or there are different kinds of dysgraphia, just like there's different kinds of dyslexia. So sometimes we don't, when you see a diagnosis of one thing, you're right, don't stop looking, but also as a teacher or as a parent, don't assume that it's not impacting something else that we may not have thought of just because it wasn't in the DSM or the explanation that the doctor gave you.
Well, yes, and then also to consider the options when it in terms of interventions, because there are some interventions that aren't suited for all things. And maybe the intervention for a dyslexic may not be the perfect choice for someone that has autism and dyslexia or ADHD and dyslexia. You need to
Very.
consider the conditions. And then the one that I see with autism often, if they're nonverbal, they don't dive in further. It's just, oh, they're nonverbal, and it's not apraxia or selective mutism or anything like that. It's just accepted that some individuals with autism are nonverbal.
Well, and then I get that nonverbal is what we generally write in a report, right? But unless you've had an experience that will tell you whether it's expressive or receptive, like, is it just because they're not understanding what they're hearing? Or is it because they really can't, like, is it a motor difficulty? Is it a thought processing difficulty? Like, there's so many nuances that we need to look at, especially when looking at co-occurring. Just because you're autistic does not mean you're going to be nonverbal, right? It does not mean you're going to be a situational mute, but those things are possible, and those things are different co-occurring diagnoses. So there's a few things like sensory processing disorder is no longer considered its own separate disorder, but frequently occurs with autism, but only about 75 to 80% actually overlap. So you can actually have sensory processing disorder without having autism, and you can have autism without having sensory processing disorder. Same thing is, I have what's called aphantasia. I don't make pictures in my head, right? So if somebody asks me to visualize something, I'm going to be like, nope, I'm out, because I can't. But that's a very, very small percentage of the population. They're thinking it's only 2 to 3%, but it happens higher with people with autism. So people often use the stereotype that autistics are visual thinkers. Not all of us, right? We have a higher percentage of aphantasia. And then an even smaller subset, this is what confuses some people, is an even smaller subset of aphantasia dream in full color and full pictures. So just because you can't make pictures in your head doesn't mean you don't have that diagnosis, right? So it's, again, that co-occurring thing. You might be missing one piece, doesn't mean you don't have the whole diagnosis, right? Or that some parts of it help explain to others.
For sure. And then at least I feel it's important to consider all the pieces together before putting together that intervention.
Yes. And if you have an interventionist who's only looking at one piece, so only addressing the dyslexia or only addressing fine motor skills or gross motor skills, that doesn't really, like, you have to have somebody, or at least a team, that can look at all the different parts. And sometimes finding a team that's on your wavelength and willing to accept that you're still looking to figure out what all the co-occurrences are, so sometimes that's worth its weight in gold.
Well, yeah, and understand that professionals can only have so much experience with so many different conditions, right? And as a professional, you have to be willing to say, look, I'm not an expert in that area, and while I can help you with these areas, I think it best you try and find someone else to help support you in this. And, frequently I do that in my practice, where I'll say, look, I can help you with this side of things, but, I can give you advice, but I wouldn't consider it an intervention to support this.
Yeah, and I've had several where I've just had to explain to parents that, look, I don't have the experience with this particular diagnosis. Apraxia was one of them a few years ago, where I didn't have a lot of experience with it, but I explained to a few sets of parents that I'm willing to learn. Like, I'm willing to let you teach me, and then I'm willing to let you know how I think my expertise would apply to what you've taught me, right? So that's a possibility too. And then I've just happened to have a steady, 1 or 2 clients a year with apraxia, so that I can learn more and learn more and learn more, because I was open to at least one, right? So open-minded people who are continually willing to learn. But you know what, like you said, I don't have a lot of experience with Down syndrome, right? So that may not, I'm probably not the person you are looking for when it comes to knowledge about Down syndrome. But you want to know about twice exceptional kids or fetal alcohol, autism, like, I do have experience with a lot of other things. So also make sure your professionals are genuinely willing to learn, because I get it. Some of us are just trying to do our job, but we're not always. We're just like, oh no, I can do that, and then keep on going, and that's not necessarily what you're looking for, right?
And be willing to admit your limitations. Like, I know personally, I focus on the academic interventions. I can provide behavior support, but I'm not a behavior interventionist,
Yeah.
even though I understand the concepts. And, I feel comfortable doing executive functioning support, but I feel that follows into um, the academic intervention category.
Mhm.
And that's another thing, like something like that executive functioning is something that's a weakness in several
Yes.
of these areas, right? So it may not be that the professional is an expert in your area, but they may be an expert in the area or in one of the weaknesses in your areas.
Yes, and that's why sometimes the team is important, right? So being able to have those people that have the different pieces to help add up, especially with co-occurring things, right? Sometimes we might not understand how ADHD can heighten anxiety, right? Just the speed of the brain or the speed of the body can just heighten anxiety and paranoia naturally, right? So then is it generalized anxiety? Is it a more specific anxiety? Is it trauma? Like, so you need somebody who understands that one can play the other. Also, that sometimes the side effects of medication to at least go, I know these two things are not, don't look, you need to talk to a doctor again because these two things don't seem to be working well together, or one is making the other worse, but professionals that are willing to say, I think we need more help. Or this is a part that's, we've got everything else in a row, but this part doesn't seem to quite fit or quite work, right? And that's how we find some of those co-occurring diagnoses, is that one, you've got everything else settled and this one piece still doesn't work, right? That sometimes that really helps us narrow down what else is going on.
Yeah. And so, what advice would you give to a parent or a teacher or someone who's watching that feels that a diagnosis that the individual has isn't the whole picture? Where would you suggest they go next?
Okay, so teachers first, teachers, you're not going to, or educators, you're not going to approach the parent and with I think you have the wrong diagnosis, right? I think what you want to do in that case is approach with a lot of, this is what I'm seeing, are you seeing this at home, right? Because if we can narrow down the, this is what I'm seeing, this is what you're seeing, then we have at least given the parents a list to then take, right, to a professional, whether it be a doctor, a psychiatrist, a psychologist, whatever their next step may be. So being able to, this is what we see at school, this is what we see at home. But as an educator, you have to be somewhat familiar with the DSM. And I'm not talking about every single thing that's in there, right? But the things that you're most often seeing in your classroom. Look it up in the DSM. I know it's like this thick and don't be afraid of it, but it does have some things in there that would make it easy. The NIM, I think it is, in the United States has a pretty good, this is what it actually means, or understood is another good resource for educators where they can go and it's kind of translated into, this is what you might see in your classroom. But educators also need to realize that there could be more than one thing. So don't narrow down to, I think your kid has this. It's this is what I'm seeing, right? Because unless you're familiar with a wider range of things, or you have access to someone who, like, I'm fairly familiar with Tourette's, but I work with someone who is extremely familiar with Tourette's, right? So I'm going to go, I think it looks like this. What do you think it looks like? Right. And then we can go through and is this a Tourette's thing, or is this an anxiety thing, or is this an OCD thing? Right. So to be able to have those people to work through. So don't label it for parents, tell them what you're seeing. Okay. And for parents, it's keep an open mind. Just because a doctor told you, no, not all of our doctors are experts, right? They have seen a few kids with this, so they know the stereotypes, right? Or they know the line in the DSM that they're supposed to quote back, right? To see if the behavior fits or the reaction fits, that sort of thing. But if they don't have like specific strict experience with a lot of comorbidities or co-occurring things, then don't be afraid to go, can you refer me to someone else who? Right? So I'm seeing these things. Can you refer me to someone who could help me narrow down to figure out what's going on? Whether it be a sleep clinic or a psychiatrist, or like there are a lot of different people in our system that we may not be aware of, that we can, you know, help to narrow these things down and bring in for expertise. So in the Lower Mainland, BCCH is a great resource. They have some great research projects and stuff going on as well that give us access to some people who have some really good expertise in these areas. So that comes in handy. But parents also need to remember that when teachers are giving you things that I'm seeing this, hopefully it's done in a way that it's not like your kid is doing this again, right? Then you're not trying to break the parents down. We're just trying to let you know that there's something else going on, and we want to help you figure out the puzzle, right? So that's important as well.
And it's important to realize as parents that children express themselves differently than they do at home. So just because something's occurring at home doesn't mean that it's going to be occurring elsewhere, especially when there comes the possibility of masking behaviors, right?
Yes, masking or fawning behaviors.
Yeah.
Right. So fawning behaviors at school might look like making everybody happy. And then after lunch, I can't make everybody happy anymore, and I'm just going to lose my poop. Right. But it can also be I get home after school and I have fawned and masked all day. Like I have hidden everything. I have kept it down. And then I have tried to make everybody happy so they would leave me alone. And then you get home and you have that meltdown. Right. So teachers need to know that they don't know what goes on at home. And parents need to remember that they don't always know what goes on at school, especially during COVID. It's not like you can go in and watch, depending on your school board's rules, right? So we need to remember that we're the members of a team. We're not here to fight against each other. And I think sometimes the system kind of sets us up in a way that teachers don't know what to do. So they come across as short. When they are an expert in their classroom, but the system hasn't made them feel that way. So, right, so we're dealing with a lot of background stuff. And then often when you have certain comorbidities, some of them are genetic. You can actually follow them back in a family, right? So I can follow ADHD in my husband's family several years back. I can do the same with autism in my family. I can follow it back several generations and figure out that they may have not have been officially diagnosed, but it was pretty close, right? So we sometimes have to remember that if the child is showing some of these symptoms, that the parent may be trying to struggle and deal with them too, or have been told all their life that there's nothing wrong with them, they're just lazy or whatever. There's a lot when we're dealing with each other that we have to be just conscious and aware of, and remember to not attack each other. That technically we're all here to help. That can be very important, and especially so I work with complex families where you might have one parent has a certain set of their kids co-occurring and the other parent has the other things, right? So you're like, okay, I'm going to try to play to their strengths the best that I can. But teachers don't see their parents that often, right? Like they don't see the parents of their children. So they may not realize, you may not realize that parent that talks really super fast in a parent teacher interview has a co-occurring diagnosis of ADHD and nobody's ever told them. Or it could be anxiety. And nobody's ever told them that that's a symptom of anxiety, right? Of trying to get this over with, type of talk, right? There's so many factors to look at.
And I think that's an important thing that you're bringing up about the parents having the similar condition. And we're in an age where a lot of parents didn't have the opportunity for the diagnosis, especially for things like ADHD, autism, even learning disabilities. Yes. That have that genetic link to it. The parents may not have an awareness that this is actually something that they went through as a child. And then as they learn more about this, like, hey, that sounds really familiar, that like that's talking about me, right?
Yeah.
So it's understanding that these conversations can also be sensitive to them, right? So if they're just kind of having that self-realization that this is something that, you know, it's something that they went through too, and there is that genetic link to it, that it's meant to help.
Yes.
And there's all the emotions that go through that, and the self-awareness and the disability awareness. that's needed. And also, you know, say if the parent has something like a learning disability and their child's showing ADHD, but when they had their diagnosis of a learning disability, they should also have had the co-occurring ADHD. And they're just discovering this through their child.
Yeah, sometimes you have to have the mini me to be able to go, oh, that's what it feels like for me too, right? And sometimes because you do have the mini me, you have accommodated so many things without thinking about it because you needed those accommodations in your life. So the parents may not always be seeing it because they're like, but I just don't
Right?
take my kid to a park who has more than 3 kids because he doesn't have the social communication skills. I drive to the next park. You know, like, okay, that's awesome accommodation. However, we should be aware of your restricted social communication and maybe we should work on that part, right? Sometimes parents are overly accommodating and not in a bad way, right? They're trying to make their kid function in life, but that's because they learned those coping skills. And unfortunately, it's easier to notice in the families that may not have been able to develop those coping skills, right? Because if it went back 2 or 3 generations, right, where it's you were just lazy and like they were given really bad messages about their learning disabilities or their ADHD or their OCD, for example, or their depression, right? Then that maladaptive coping strategies are being handed down accidentally too.
Definitely. So this has been a great conversation about Cooccurrence. Thank you so much, Mandi. Is there any way that you want to give people to get a hold of you if they have more questions?
I am available at Mandi, which is Mandi at epiccollaborative.ca.
Great. And we'll be posting that up afterwards. So thank you, everybody. And I hope you have a great weekend.